Here, you can just spread out right behind here. All right, good morning. Thank you all for joining us here today. I am joined today by Patrick Cunningham, the Deputy Mayor of the City of Rochester, Lauren Spicher, the Executive Director of 1330 Cancer Connect, Dr. Jeff Andolina from the University of Rochester Medical Center, Dr. Michael Stolten from Rochester Regional Health, and Brittany McNair from 1330 Cancer Connect participant and a cancer survivor. I want to thank them for being here with me this morning and joining together to mark the beginning of Adolescent and Young Adult Cancer Awareness Month, and to hear more about the transformative care and programs 1330 Cancer Connect provides adolescents and young adults, or AYAs, in our community living with cancer. 1330, originally known as Melissa's Living Legacy Teen Center Foundation, was established in 2001 after founder Lauren Spicher's 19-year-old daughter Melissa passed away from myelodysplastic syndrome, a rare bone marrow malignancy. As Melissa's precious time on earth neared its end, she asked her mother to promise that she would take their experience and use it to make a difference and to make things better. Throughout the 2 years Melissa lived with cancer, Lauren recognized a gap in programs and services for adolescents and young adults living with cancer, simultaneously too old and too young for the services offered by pediatric and adult care. AYAs have unique needs and experiences living with cancer, and Lauren was determined to build the safety net and support network they deserve. 1330 Cancer Connect began as a grassroots effort around her dining room table, where peers connected with one another and found support in their shared experiences. With offices in Rochester and Syracuse, 1330 Cancer Connect has since evolved into an internationally recognized leader in adolescent and young adult cancer care, offering peer programs centered in art, wellness, and social gatherings, along with workshops and special presentations to educators and healthcare providers. Every day, throughout the past 21 years, Lauren's kept her promise to her daughter, and we are honored to have her here today to mark the beginning of the AYA Cancer Awareness Month and to thank 1330 Cancer Connect for all that they do for the young people who call our region home here across the country and across the world, and to make sure that young people who are being treated with cancer and undergoing therapies and treatment know that they are not alone, that their community is here for them, that they are loved, and that we are here to support them from all aspects of our society and our community. And so with that, I'd like to bring up one of my partners in government here, the Deputy Mayor of the City of Rochester, Patrick Cunningham.
Thank you, Adam. I happen to be a member of the Wilmot Cancer Institute Board, so this subject is near and dear to me, and I'm delighted to be here to speak to you. The City of Rochester is proud to have 1330 Cancer Connect and its services available to our community. We recognize that 1330 is part of what gives Rochester a reputation for excellence in healthcare. For teens and young adults, 1330 offers critical supports. I cannot imagine what it's like poised to start your adult life and be confronted with such an overwhelming challenge. But young people at 1330 do know, and they are there for each other. It's important to nurture social connections as a vital element in healing. Young people treated with compassion today can become compassionate leaders we need in our future as they transition from patient to survivor. Lighting up the city in blue and green is a gesture, but it reflects our commitment to Rochester and Monroe County's health and well-being at all levels. So thank you, 1330, for being part of our city and for the friendships and healing you facilitate for teens and young adults here and across the globe. Thank you.
Thank you. You're good. All right, thank you, Patrick. And next up speaking is Lauren Spicher, the Executive Director of 1330 Cancer Connect.
Each year in the United States, 90,000 adolescents and young adults, AYAs, are diagnosed with cancer. Every 6 minutes, a young person hears the words, "You have cancer." Every 6 minutes in this country, somewhere, a young person's life is interrupted, and for far too many, that interruption is forever. As the county exec already said, our 17-year-old daughter, Melissa, was one of those young people 24 years ago. Sadly, Melissa died 2 years later, but because Melissa lived, I am honored to be here today with all of you. So thank you, County Executive Bello and Deputy Mayor Cunningham, for using your county and city platforms to help us spread the word of AYA cancer. Your presence here today is testament not only to your compassion and goodwill, but recognition of the need to do more for our AYAs with cancer and to do it better. And that's what we're doing here together. Though 1330 Cancer Connect was not there for Melissa, it certainly is because of her. As has already been said, just 3 nights before Melissa died, she issued me a challenge. She said, do something to make a difference, to make things better. And for the last 22 years, I've been trying my best to keep my promise to Melissa. And for 22 years, we have been making a difference for thousands of AYAs, not only in the 2 communities where we have physical centers, community Rochester and Syracuse, but for AYAs globally, virtually. At 1330 Cancer Connect, our members build a new peer community where those things which are hard to talk about, to even think about, are able to be shared in our safe, welcoming space. And together, at 1330, our AYAs are able to recover pieces of what was lost and then discover new possibilities, all with friends who understand. When I started this effort way back in 2001, there was very little being said about our adolescents and young adults. No longer children, but not yet fully independent adults. Our AYAs were and are still being caught in the middle in a very difficult gap between our 2 existing healthcare systems, pediatric and adult medicine. Thankfully, the landscape of care for our AYAs is changing. As Doctors Andolina and Smolten will tell us very soon, we are starting to pay more attention to the very unique medical and psychosocial challenges facing our AYAs, but there's still much more that needs to be done. When asked, many in our community agreed to do a variety of fundraising and awareness events. As the Deputy Mayor just told you, this week, all of Rochester will be lit blue and green. Green for new growth and opportunity. Blue for calm sailing, which is what we hope for our AYAs, not only this month, but for always. Since we started, several advocacy groups have sprung up recognizing adolescents and young adults with cancer. And for many, this first week in April is recognized as AYA Cancer Awareness Month. But we didn't think 1 week was enough. So we think our teens and young adults deserve much more than 1 week. So we here at 1330 Cancer Connect are deeming the entire month of April dedicated to the most courageous and dedicated and spirited people that I have been privileged to know and love all these years. So now I'd like to recognize all of our Community 1330 champions who are helping us this month. Those partners include Buckingham Properties, Butler Till, Canalside Music Together, Doughboys, Hilton High School Boys Golf Team, Lights on Rock, Penfield High School Girls Lacrosse Team, Red Robin, Rockfit Collective, Rochester General Hospital, Rock Strong Club, St. John Fisher College men's and women's tennis teams, Sense by Design, Candle Bar, Statement Boutique, Strong Memorial Hospital, University of Rochester's women's lacrosse team, Upstate Bottle Return, Upstate Vintage Market, the Victor Village Inn, and Yoga Plus. Thank you all for helping me keep my promise. Together, you are all also making truly a difference and making things better, just as Melissa asked of me all those years ago. I invite all of you, please come and visit us at our center. We'd love to tell you more about our mission and invite you to learn more about how you might help us. The coffee is always on, so I would love to have you come and visit. So with that, I just say thank you again. Thank you to the County of Monroe and the City of Rochester for helping us spread awareness for this very, very much needed cause. So thank you.
Thank you, Lauren. And I just want to comment. What a remarkable thing that you've done to take Melissa's legacy and pay it forward. And you did fulfill your promise. You've helped thousands of people in our community and provide that support for all these young people who are facing a cancer diagnosis, and it really is just an incredible thing that you've done for our community, so thank you. I next want to invite up Dr. Jeff Andolina from the University of Rochester Medical Center.
Thank you all for allowing me to speak today. My name is Jeff Andolina. I'm a pediatric oncologist at the University of Rochester, Golisano Children's Hospital, and Wilmot Cancer Center. Cancer affects all age groups, and adolescents and young adults are no exception. And cancer is so often under-recognized and under-resourced in these age groups. Adolescent and young adult patients face numerous barriers which often make their treatment more difficult than older adults and younger children. AYA patients are often in a time of their lives without strong family support, stuck between their childhood home and living with an adult partner. They tend to have very aggressive cancers, including bone tumors, sarcomas, leukemias, and lymphomas. Insurance, mental health, and fertility issues are critically important to many AYAs. And medically, as has been said, AYAs can find themselves stuck between children's hospitals and adult cancer centers. And historically, there has been a lack of research, clinical trials, and new treatments geared toward adolescents and young adults and their diseases. As would be expected, all of these factors have led to a lack of improvement in survival for these patients in this age range. How can we help? Raising awareness, increasing resources, advancing clinical research, and having dedicated medical teams and supportive care teams are very important. Rochester is lucky to have multiple medical teams with interest and expertise in AYA cancer on both the pediatric and adult sides, including dedicated physicians, nurses, and staff who are committed to helping young adults. Even more importantly, community groups such as 1330 are wonderful resources for patients in our community. Through the hard work of Lauren, Steve, and others, our young cancer patients have access to peer groups, social outings, and financial and medical support as they continue through their treatments. Many young adult cancer patients simply want to live their lives and not be defined by their illness. There's so much work to be done for adolescents and young adults with cancer. I'm very proud to work as a part of multiple medical teams at Golisano Children's Hospital and Wilmot Cancer Center to try to help these wonderful patients. I'm thankful for the support of the Rochester community and 1330. Thank you.
Thank you, Dr. Andolina. And one thing that I've grown to really appreciate about our community is that we have two very fantastic healthcare networks with University of Rochester Medical Center and Rochester Regional Health that work collaboratively together to provide medical care to our community. So joining us today, we also have Dr. Michael Stolten from Rochester Regional Health to share a few words.
So again, Dr. Stolten, I'm a radiation oncologist at Rochester Regional, and thank you for everyone for allowing me to speak today and involve me in this great time to recognize AYA and the things that they've done over the years. So Rochester Regional does share kind of the 1330 Cancer Connects mission in terms of kind of taking care of the whole patient and certainly helping them thrive in the years to come, even after their diagnosis, after their treatment. And I think that's a major, it's a major thing that we try and make sure that we don't lose sight of, because it's good to focus on the patient while they're in the clinic getting their treatment, but also we know long term in the many years to come, there are a lot of other issues, both physical and psychosocial, that maybe we don't do as good of a job. And thanks to 1330 and other groups, we're starting to get more aware of that and making sure that we recognize that that's an important thing. I do echo Dr. Andolina's comments in terms of kind of the disparities that we do see between non-pediatric patients, but not really adult patients either. And because they're kind of caught in the middle, the outcomes unfortunately reflect a worse survival, a worse prognosis, even for the same cancers that are otherwise better treated in the younger or older populations respectively. So part of that is the biology of the actual cancer being more aggressive, as Dr. Andolina mentioned, but I think the things that we can do on our end is supporting them in ways that maybe they weren't supported. For example, I was talking with Lauren that pediatric patients have their family, they have people that kind of help them get to appointments to support them when they're not feeling well. Adult patients tend to have their younger kids, if they're old enough, they have their spouse, they have everyone else in their community that they've built to support them. But kids in their late teens and in their 20s, or maybe off in college, they're out by themselves. They don't have that kind of resources that maybe the other people have. And I think by kind of filling that gap with programs like 1330, we can at least help improve those outcomes associated with that. I have a personal, passion about survivorship in general. We are starting a hopefully standalone survivorship clinic that can kind of be the bridge to some of these patients in the years to come that they may not be best served by seeing their oncologist 10 years later, but maybe it's too much for their primary care provider. And so I think having a place for them and also a center for where they can get all the resources that 1330 and other AYA groups can provide them will really help them out, or at least that's the goal. I also have a personal affiliation with AYA. As I was 23 when I was diagnosed with primary malignant brain tumor. And I think, an AYA program back in Oregon actually helped me out financially for fertility preservation, which, the vast majority of states in the U.S., insurance does not cover that. I think it's only like 19, and then only 11 of them actually do actual fertility preservation. So again, I think there is a lot to be done, a lot more that we can do going forward, but I think part of it is spreading the message and letting people know that there are a lot of shortfalls that we need to work on. I think being a patient first and then going into medicine has really helped me kind of focus my attention and empathy in a way that you couldn't do if you didn't actually go through it yourself. And it's really added to kind of a holistic and patient-centered approach to care, but not just treating the diagnosis, the cancer itself, but also the patient themselves, their entirety, all the psychosocial, the other long-term things that are not really related to the cancer itself, but more of the experience, the formative experience that they went through at such a young age. So I think that's a very important part to keep in mind as well. So again, we support kind of what 1330 is doing. Obviously, we hope to incorporate the resources that they have and certainly try and refer as many patients that we have that are eligible for their services in the future. And again, thank you for just including me and being part of all of this.
All right, thank you, Dr. Stolten. And our final speaker today is Brittany McNair. She's a 1330 Cancer Connect participant and also a cancer survivor.
Hello, my name is Brittany. I have been involved with 1330 since 2005 when I was diagnosed with osteosarcoma, which is a form of bone cancer. I met Lauren in the halls of the hospital, went to my first program, and was immediately hooked ever since. At my first program, I was able to meet a young man who had the same exact cancer that I had, who unfortunately has since passed away, but before he did, he was able to show me what it truly meant to live and laugh through your cancer journey, and the importance of truly making the best of every single situation that we're given in this life, the good and the bad. And I think that's what's so amazing about this organization, is that it allows you the opportunity to meet and bond with all these young, amazing people who know exactly what you're going through and understand all the struggles that cancer can bring, emotionally and physically. Whether we're just at the center, hanging out, talking, or working out at one of our fitness programs, doing a movie night, laser tag, you name it. It doesn't matter what we're doing. Just knowing that you're surrounded by people who really understand what you're going through is an amazing thing to have. I know for me, 1330 has changed my life in so many ways, and I really don't know where I would be without them. I know that I am a better person, a stronger person, a more confident person since having them in my life, and I'm just very grateful to have had them as a resource when I was sick, and to continue to have them as a resource as I'm moving on with my life and enjoying survivorship. So if you know anyone who you think could benefit from one of our programs, or if you simply want to learn more information about this amazing organization and everything that they do, please visit 1330.org. And I just want to thank each and every one of you for coming out today to hear us speak and a little bit about our stories and what this amazing organization means to all of us. And most importantly, thank you so much for coming out to help us spread awareness for AYA cancer. Thank you.
Great, thank you, Brittany. Does the media have any questions for any of the participants here? No? That means we did a good job, so that's good. Okay, so thank you. Thanks again to all the participants today in today's press conference, and also I just want to underscore why this is so important. So as young people this week and this month see green and blue lights on display, please know that the community is here to support you and provide that safety net of support for you. Please, if you're facing a cancer diagnosis, please reach out to 1330 Cancer Connect to find that network of support and love that exists in our community that's here for you. So thank you again. All right, have a good day. Thank you, everybody.